Patients with Parkinson's disease have multiple sleep disorders, and to a very big percentage. So they do have 5 to 6 different sleep disorders. The most common is REM behavior disorder. They also have obstructive sleep apnea, restless leg syndrome, excessive daytime sleepiness, problems sleeping at night. These are the most common ones, and they can be found up to 90% of the times in patients with Parkinson's disease. When a Parkinson patient first comes to the office, and also in follow-ups, we always need to ask questions about sleep. Some of the simple questions, first of all, is: are you tired during the day? Are you sleepy? Do you doze off while watching TV, for example, or when you're a passenger in a car? Do you kick, yell, or punch your bed partner at night? Do you snore at night? Do you feel that you're gasping for air and wake up frequently during the night? Do you have aching or creepy crawly feelings in your legs in the evening when you're at rest, or when you're laying in bed? These are the most usual questions that we tend to ask our patients. Every sleep disorder that I just mentioned does have treatment, so that's why it's very important to diagnose it. For example, REM behavior disorder, which is basically acting out someone's dreams, it's once diagnosed, the treatment is 2 different medication, melatonin or clonazepam, and they're actually very effective. Given before bedtime, of course, the patient will not realize if it's working or not, so we have to have a bed partner to report back if it's working, if it's effective or not. For other disorders, for example, obstructive sleep apnea, meaning you stop breathing at night, or there's an obstruction of the airway, there's a sleep study done that needs to be done. And treatment includes CPAP or surgery, or a mandibular, what we call a mandibular advancement device, such as like a mouthpiece, that can help with obstructive sleep apnea or even snoring. For restless leg syndrome, there's medications that we give for this condition, which is also Parkinson medication, so that can help with Parkinson's disease. For excessive daytime sleepiness, there's behavioral treatment, so trying to keep the patient awake, improve the patient's sleep at night, and also in extreme cases give stimulants so as to keep the patient awake during the day. The better a Parkinson patient sleeps, the better his symptoms are going to be the following day. So sleep plays a big role in Parkinson's disease treatment. One other thing that patients with Parkinson's disease need to know is that, and it doesn't necessarily help them in any way, but they need to know that the REM behavior disorder condition can precede the diagnosis of Parkinson's disease. So there can be 10 or 15 years before the actual diagnosis that the patient presents with the dream reenactment. Of course, that condition is not specific to Parkinson's disease. It can happen with other neurodegenerative conditions, but certainly it is a red flag towards a diagnosis of Parkinson's disease.